And I know in one of your pieces of content when I was following, you said that CKD is not a food problem. Like it's mostly a management problem. So can you speak a little bit into that? Like what changes for someone when they stop trying to fix, you know, their kidneys or their CKD health, and then they actually try to uh, relate to their CKD diagnosis a bit differently? Like what changes for them?
So the CKD, like I said, is not a it's not a food problem, right? It's more so of a management problem. Managing the CKD in a way where it's fully supporting and slowing down or, just helping better support your kidneys. And having ongoing support is really helpful for that. And it's not saying like, oh man, you need to be tied in and locked in with a dietitian for, here on out, but at least you can help to get that foundation of understanding what my labs are telling me. And you can get really good insight into what your labs are saying. I can read and interpret somebody's lab work to see where they're at and then where they're headed. And then based on that, looking at what they're eating, and then we can tailor, their diet or their meals. I hate the word diet. Tailor their meals to better support because I can see the gaps. And so if you are doing everything right, but you're not seeing that reflected in your labs, this is where that management can come in. Because providers, they're there to help with the medical management of the kidneys, not the nutritional management of the kidneys. So these, like you shared, these one liner tips, nutrition tips, isn't helping anybody. But you can use the medical management of the kidneys along with nutrition management to better lock in that kidney support. And so, that's just the missing piece. I don't care what anybody says, but all that on that hill. But that management of ongoing support. And then when your labs do change, what can I do now to shift my nutrition, my lifestyle, my blood pressure, blood sugars, if those are issues, to better support your kidneys moving forward. Because providers will just look at you and be like, okay, it's a number, but the number is stable. You're fine. You don't need to worry about those things. But I like to look at those trends. Those trends are important. And I want folks to understand if you are like working with me in that kind of capacity, I want you to see where your trends are. I want you to look at when you are looking at your lab work and you're seeing differences or fluctuations, that's a good indicator to have that discussion with your provider. It could be nothing, it could be hydration, but it could be something else going on that could be affecting your kidney function. So that's what I mean by management. And it's also because I have so many, not so many, I do have people coming into my DMs telling me like my GFR is this and my creatinine's this. Tell me what I can eat. And I can't do that. I legally cannot provide that. This is why you need to work in a coaching container, right? And I understand because it's healthcare, people just assume I can come in and you just tell me what to do. But there's so much more nuance to somebody's kidney health than your GFR and your creatinine. You know, it's your medical history, it's your medications, it's outside of just that panel. You're looking at your iron levels, hemoglobin levels, your thyroid. There's so many different labs that interact and play a role in your kidneys. And people don't understand that. Like, yes, your kidneys are part of your body, but it's the body works in a system, right? Your different organs can affect other organs. And so there's no difference with CKD. And so that's what I mean by having that management. Like it's so much more than just the GFR and the creatinine. It's not so simple like, here's my labs, tell me what to do. And I'm like, I can't, first of all, that's medical nutrition therapy, and I cannot do that, and I will not do that. But if that's what you're wanting to do, that's a service that, people like me can provide. But that's what I mean by that management, and then when you help somebody better understand that, they can take those little nuggets that we've discussed and help themselves moving forward.